For our video, we have decided to interview two different companies coming from two different countries. We did so not only to understand how they were affected differently, but to understand their different approaches that they took depending on their location. As seen, a lot of businesses and companies have been closed or shut down permanently worldwide due to this pandemic. This has brought upon many conflicts that were needed to be resolved as quickly as possible in order to keep these businesses afloat. In the first video, Sebastian explains how his trailer company that he had established in Ciudad Juarez, Mexico, had faced a lot of uncertainty during this time. Changes such as hygiene and shorter shifts had really affected the process. Luckily, he was able to get aid from the bank in order to keep all of his employees. This really showed him that having a savings account could be really beneficial in the long run in order to keep his company safe.
International trade was one of the most affected industries during the 2020 COVID-19 pandemic. This industry is what keeps two border cities connected, such as Ciudad Juarez, Chihuahua, Mexico, and El Paso, Texas, of the United States moving. The COVID-19 pandemic created problems for trucking companies due to the fact that international bridges were not working at full capacity because both cities had to control the virus from spreading at a rapid rate. One business owner named Sebastian Aguilar talked to us about how his trailer leasing company was affected by this pandemic.
Hello, my name is Sebastian Aguilar. I am partner and owner of Argawal Trailer Rental and Leasing. It is a company that we rent 53-foot dry van trailers to transportation companies. We also rent them to maquiladoras in Mexico. Me and my brother actually started this business when we were both very young. Started this back in 2014 with a handful of dry van trailers, and right now we're looking at over 1,500 dry van trailers used in the borderland.
How did COVID-19 affect your business?
Well, at the beginning it was uncertain when we would have to stop or close. We had to stop for a couple months at the beginning, but then we were able to reopen with some regulations. We had frequent testing of our employees, which really helped us. We were taking the precautions, having the face masks, the taking of the temperature. We had very little, no contact with customers. We did everything to help our customers and help ourselves. We also reduced shifts, smaller shifts. We didn't lay anyone off, just that way everyone could still have a job.
How did your business overcome the pandemic?
Well, we were very thankful to the Wells Fargo Bank. They helped us to get a loan, $90,000 loan with a 3.62 interest rate, payable over 10 years, which really helped us to keep everyone, to not have to lay anyone off. And also it helped us with closing the first couple of months. And after that, business slowly but surely just kept going.
After the pandemic, were there any changes to your business?
Well, there were some changes, not that many. First of all, would be hygiene. People, we wash our hands more frequently. We respect more when people are sick, when people used to come to the office with like a little flu or something. Also, we started to look at savings more seriously, since thankfully we were able to get that loan from the bank, but that might not be always the case. So you might want to have a couple of savings in the bank. Also, we're looking into getting different insurance, that helps the employees the most, since they are the ones that would need the money, so if they would have to be laid off. And the biggest one was new clauses on contracts. Since, for example, we had to meet the demands for one of our companies that we rent the trailers to, and we didn't have enough manpower to get the trailers out that they needed. So there were some problems there, but with this it taught us that we need to have different clauses in case of a new pandemic.
Not only was Argawal trailer leasing affected by this pandemic, but many trucking companies faced problems with emission standards that were first introduced in 2022. Trucking companies suffered financial problems because many of their equipment were outdated and did not meet emission standards set by the United States, Mexico, and Canada governments in part of the USMCA agreement.
In the second video, NImisha made predictions on what state the world would be in 4 years from now. She proceeds by asking questions to Dr. Victoria Slate on what she predicts would happen in the near future. Dr. Slate explains different procedures and precautions that they had taken at her office during this time of global pandemic. One of her main concerns was not that the government had not done their part and taken the right steps to prevent the mass spreading, but that it was the fault of us people. Not wearing our mask correctly, having it under the nose, and still going to large gatherings is what we believe to have caused the massive spreading of this virus. Although I personally believe that the government could have done a lot more in order to decrease the rapid rate and spread of this virus, there was not much we could do at this point. As I predict that as long as everyone continues to take the right precautions and wear their mask and sanitize and have good hygiene, I believe that we will see a decline in cases in these coming months. In this next clip, we will be learning more about the vaccine and how it may affect the outcome of this global pandemic in the following years or even in the following months.
Governments around the world pledged billions of dollars for COVID-19 vaccine. There were many pharmaceutical firms that were in the race to develop a vaccine, so the world could go back to normal as we know it. During the winter of 2020, the CDC projected that the number of active cases were to be estimated at 15 million and the deaths at 415,000. Nearly 4 years later, this was not the case. The active cases surpassed the projected number by 25 million, and the death toll was significant to about 600,000 deaths. While other countries were able to return to normalcy after the virus with fewer casualties and less in time, in the US had yet to reach its worst numbers. Here in the countries like Paris and China were able to get the virus under control within 3 to 4 months, while the US saw increasing numbers continue through the 9th month and on. Hospitals had to ramp up their testing and treatment to minimize the spread amongst patients and healthcare providers. There were many challenges that were faced in America's healthcare system. COVID-19 has greatly impacted 2020 and the way people live their daily lives, more specifically the lives of doctors, nurses, and other healthcare workers that have been putting their own lives on the line since the first outbreak of COVID occurred. The number of people seeking treatment has severely increased, therefore the demand for medical supplies and equipment has increased as well. Because of the increase of demand, the supply chains have been disrupted, which increases the cost as well, affecting how much it costs to treat COVID-19 patients. Due to the heroic effort, hospitals and healthcare systems have come together to support healthcare workers by providing essentials such as transportation, childcare, and sometimes even housing. Aside from COVID-19 affecting the medical field, it has led to unprecedented job losses, which has made the employed and uninsured skyrocket. The United States health system faced financial challenges during the pandemic. The American Hospital Association established four major challenges during the pandemic, and they were the effect of COVID-19 hospitalization and the hospital costs, the effect canceled and foregone services caused by COVID-19 on hospital revenue, the additional costs associated with purchasing needed personal protective equipment and PPE in this case, and the cost of additional support to the frontline health workers. Joining us today, we have Dr. Victoria Slate from the UT Health Science Center. So once the vaccine was distributed, did you believe that the US was able to return to normalcy? If we hadn't, do you believe that the United States can ever return back to normalcy after enduring the pandemic for so long?
Yes, I do believe that we can return back to normalcy. It is going to take quite a bit of time. I know that when the pandemic first happened, it took us a lot of time to get used to everything, wearing the masks, wearing the gloves, being more thorough on our hand washing, making sure that whoever you came in contact wasn't sick, and so forth and so on. So just like anything new, it is going to take time to get accustomed to it, but I do believe that the US can get back to normalcy.
Perfect. And then as someone in the medical field during the years of the pandemic, do you believe having a lack of medical supplies and resources was one of the main causes that the pandemic went on for so long?
No, I truly believe that the main cause of the pandemic was people still gathering in large amount of numbers, not wearing their masks correctly. They either had it under their nose or they had it hanging off one ear. Nobody was really taking it serious as far as, making sure that they were protected and the others around them were protected. And that is what made the virus spread. And that's what made the pandemic last as long as it did, not because of the lack of PPE.
Perfect. And then with healthcare having been a focus for the presidential election back in 2020, do you believe as a medical professional, if everyone were to have been able to have affordable healthcare, would it have really made a difference in the amount of people that got infected or died because of the virus?
Not the amount of people that got infected, because like I previously stated, the reason why the pandemic lasted so long was because nobody was taking it seriously. Nobody washed their hands thoroughly. Everybody was still gathering in numbers. So the virus was still going to spread. But if people did have medical insurance, they were more than likely going to go to the hospital as soon as they started presenting with symptoms. A lot of the patients that we saw that came in are already at the end stage of what the virus can do to the human body, solely because they were too scared to pay for thousands of dollars when they didn't have medical insurance. So if people did have medical insurance, the amount of deaths that we saw probably would have been less, but the amount of people infected would not have mattered.
Perfect. And then piggybacking off the last question, it was a known fact that minorities had less insurance during that time. Do you believe, as far as your experience, that more minorities were getting infected and possibly dying than the majority of those who were able to receive a good health insurance?
I wouldn't say that the majority of people that were infected were minorities. It was a very well-rounded virus. It spread fast, it mutated rapidly. But the amount of deaths that we did see were a lot of minorities because, like before, a lot of minorities don't have the health insurance. And so they're scared to even step foot into the hospital the first moment that they came in contact with the virus or they started showing symptoms. So we did see a large number of minorities be the main cause of all the deaths that we did see.
And do you believe that the virus helps the medical field become more prepared for another pandemic in the future? As in, were their medical supplies stocked for more of an impact when it came to the amount of patients? Were you provided with extra PPE equipment to be better prepared in a similar case for the future?
For a similar case, yes, definitely. I do feel that the medical field is more prepared for a similar case. Now, we don't know what the next pandemic is going to be. We don't know how the virus or the bacteria is going to affect human bodies. We don't know how long the pandemic might last. It's very hard to tell. But for a similar situation like COVID-19, where it caused a lot of respiratory issues, I feel like, yes, we are more prepared for that.
And do you, as a medical professional, ever feared for your own safety while caring for your patients? And if you did, do you believe it was the government's responsibility to provide a peace of mind to the medical professional?
I'm not going to lie, like everything new, it is scary. You walked into a patient room not knowing whether they are positive or negative, and walking into a COVID unit in general is very terrifying. But I don't necessarily blame the government. I blame social media for not providing accurate data and information the way it was presented from the CDC and the WHO, the World Health Organization, but it's not necessarily the government's fault.
And then piggybacking off the last question, do you hold any type of resentment towards the government for not providing the appropriate amount of resources at that time? And if so, could you elaborate?
I don't hold the government accountable just because when the pandemic started, we had no clue what to expect. We didn't know how this virus was spread. We didn't know how it would infect the human body. And we definitely didn't know the impact that was going to have on society. So I don't blame the government for the lack of PPE. But once we got more information, once we saw how the virus was spread and we started getting more PPE, we did see a majority of healthcare workers having the appropriate uniform, the appropriate masks to actually help fight the virus. So I don't blame anything on the government. It is very hard to prepare for something that you had no clue was going to happen in the first place.
Right. And then after the presidential election, the government started to step into high gear and started passing more pandemic relief and more policies to help eradicate the virus. Do you believe that this played a bigger part than the vaccine did at helping to eradicate the virus? Or do you believe it was a combination of the two?
I definitely see that it was a combination of both. People saw that there was finally a vaccine out there that I can actually do something to help myself instead of hiding in my home and hoping for the best. So having that vaccine gave the peace of mind to a lot of people, but also having the government really back up the healthcare workers and back up the proper information did help a lot too, because it gave a lot of insight to actually what was happening. And so it always is a combination of both. Whenever the government is involved in something as big and we actually had the vaccine to help, it did make a big difference.
Right. So then going off that last question, the vaccine did come out at the end of 2020. So when the vaccine was released, they came up with it and distributed it so fast that the known side effects were not clear. When the vaccine was distributed, there were people that were still getting sick and were being vaccinated, but the amount of cases did go down. Do you, as a medical professional, believe that the vaccine should have been rushed and released so quickly? Or do you believe that the precautions should have been enforced stronger, that the vaccine could have been researched and perfected more?
Well, before any vaccine is given out into the general public, it goes through some rigorous testing. So for the vaccine to actually be distributed as fast as it was, it did go through a lot of testing to make sure that it was the correct vaccine and it wasn't going to be and it wasn't going to cause more problems than the actual virus. So I do believe that the vaccine was proper in the way that it was released. But again, everybody's immune system is different. Everybody's going to react to things differently. When the vaccine was put out in the general public, we did see a dramatic drop in numbers, which helped. But those people that did get sick, it's just their immune system probably wasn't responding well to the vaccine. And it's very hard to tell because, like I said, everybody is different.